Welcome to Public Health Matters, where we talk about matters in public health. I'm Jane Goodman, Public Health Strategist with the Nashua Division of Public Health and Community Services. I have a very special guest today. I'd like to welcome Lisa Vasquez. Lisa is our Behavioral Health Strategist at the division. Did I say that new title correctly?
Yes, you did.
So,
First one.
Yay. So we're getting the word out already, Lisa.
Yes.
So Lisa joins me today to talk about two pretty large events in the city and in the neighboring region. So first and foremost, let's talk about what's going on this weekend, which is Drug Take Back Day.
Yes. So tomorrow is National DEA Take Back Day. It's a national event. So police departments across the nation will be participating in the Take Back Day. Right here in Nashua, our Nashua Police Department is participating. It's an awesome event where people can take the time to look through their medicine cabinets. Anything that is expired, unused, unwanted can be disposed of safely at our DEA Take Back location. So I was almost going to say police department, but the National Police Department has a separate location for the Take Back Day. It's going to be at the DPW garage. It's at 9, totally blanked. 9
right
Stadium Drive.
Oh, okay. And I did see a big thing on the marquee driving in here today.
Yes,
so it's close to where we are now.
Yes. So it's almost like you're going to the Nashua Police Department. You just keep going a little further at the DPW garage. It's a drive-through, so you don't have to get out of your car. You pretty much drive up to where the police officers are. They'll have a box where you just throw in your unwanted or unused expired medication, and then you just drive off. So there, it's contactless.
Mm-hmm. That's great. So what do they do with the medication once they collect it all?
So it is incinerated, so it's disposed of in a way that no one else can use it.
Do they recycle the bottles at all? I'm just curious.
I'm not sure what they do with the bottles, but I know that the medications are incinerated so that other people don't have access to them. It's actually a better way to dispose of them than if you flush them. We want no one flushing anything down the toilet because it goes into our water system.
Okay.
So to maintain our environment, we want to make sure that people dispose of them in a safe way. If for some reason people are unable to participate tomorrow at the DEA Take Back Day, it's going to be again from 10 a.m. to 2 p.m. at 9 Stellos Drive. That's the DPW garage. And there'll be signage to so people know where to drive through. Mm-hmm. But if people can't participate, they can always go to their local police departments. Most of our police departments in the greater Nashua region have a permanent drop box. Mm-hmm. So right here, if people go to the lobby of the police department, there's a box right there. They can just go in, drop it off, no questions asked. Also, our hospitals each have a medication disposal box, as well as 2 of our pharmacies on Main Street, and I think it's Walgreens and CVS.
Wow, so there are a lot of places that you can do this. And so even though it is coming up this weekend, this is an ongoing thing to kind of look through your prescription drugs and get them out of the house if you're not using them anymore. And the origins of this really go back to some of the opioid addiction and painkiller addiction that was happening when there are unused pills, if they get into the wrong hands. So tell me a little bit about the origins of how this was created.
So this was created for the purpose of getting unwanted, unused prescriptions out of our community because of the same reasons that you said. So people were accessing other people's opioids through their medicine cabinet. So even today, when we do the Youth Risk Behavior Survey, which is a survey done of high schoolers, the ones that use prescription substances that are not prescribed to them say that they access them through like a friend, a family member, mm-hmm. or like a medicine cabinet. So it's really important that people dispose of any medication that they do not use. But if they are currently using a medication, it should still be secured in a way that it's only accessible to the person that it is prescribed to.
Mm-hmm. And I was just going to ask you that.
It's
to remind people to lock your medicines up or keep them safe or away from prying eyes and hands and
Exactly. We don't
kids.
know who is prone to have a substance use disorder and who is not, so it's best to not have it available to anyone that it is not prescribed to. And especially if you have young kids at home, every year, that like thousands of kids end up in the emergency room because they took medication not intended for them, like little ones. So we want to make sure that if you have little kiddos at home, even if you think, oh, it has the adult lock on it and things like that, kids are pretty ingenious.
Yes,
they
they
can
are.
figure stuff out really easily. So it's really important to make sure that medications are out of the hands of little ones, especially, but also high schoolers sometimes want to experiment with things. It's really important for kids, high schoolers, not to have access to medication that they are not prescribed to. And even if they are prescribed to them, it's important that they understand how it should be used. It should be used in a way that it is prescribed and no other way. So if, for example, they have their wisdom teeth taken out and the dentist says, you take one a day, they need to take one of those prescriptions a day. They shouldn't take two, they shouldn't take three. It's really important for them to follow those instructions for their safety and make sure that they don't share those medications, because even if another person is prescribed the same medication, they might be prescribed it with a different dosage.
Sure.
So it's really
If you're a different
important.
weight or whatever,
Yes.
yep.
It's really important that people do not share medications.
So you reminded me of something. Of course, it's going to slip right out. It doesn't just have to be opioids or painkillers that we're getting rid of. This is really all medications, because like you're saying, there is a safety issue if it's taken for the wrong reason. We don't know what those reactions are. So this is really all prescription medications.
Yes, any prescription medication that you have and you want to dispose of safely because it is expired, you're no longer using it, or it's unneeded, you are welcome to use the take back day as a safe way to dispose of that medication.
All right. And then on the other side, on the provider side, I think there has been some progress, and maybe you can speak to this as far as, you mentioned wisdom teeth. And that's a thing that often happens in the teenage years, speaking from experience and watching my own kids go through that, and the amount of pills that are actually prescribed. I think that oral surgeons, dentists, orthopedic surgeons are being more cognizant of how to prescribe medication and not to overprescribe.
Yes. So right now we have the drug monitoring program, which monitors how much medication is prescribed to each person, how much is filled, what pharmacies people go to pick up that medication, just to make sure people are not, doctor shopping, and making sure that they only have one prescription per doctor per pharmacy, so that, it reduces the risk of duplication and excessive prescriptions for a particular person. Also, there has been a lot of education to prescribers as to how much to prescribe. So in the past, we saw that even for like oral surgery or anything like that, the prescriptions had a lot of pills compared to nowadays, the amount is a lot smaller than it used to be, because most people don't need that many for a long period of time. They usually only use medication for like the first 2 or 3 days, and then the rest of that medication is usually unused.
Yeah, so that has helped too on that other side, so there isn't as much excess drug in the area of children or teens or that kind of thing. So that is a big event, and I just do want to reiterate that just because that's this weekend, that can, like you said, it can always drop off at other local police stations. They all have disposal bins. Our local hospitals do, and also some local pharmacies. So
Yes.
it's not just a one-shot deal. We market with this weekend, but we continue to do this throughout the year.
Definitely. And if people want to know, like if they're watching this but they don't live in Nashua, they can always go to takebackday.dea.gov to check out which location is closest to them for tomorrow from, again, 10 a.m. to 2 p.m. But also many of our police departments also have permanent take-back boxes where people can, dispose of unwanted medications at any time.
Okay, great. Do they generally get a good participation for these kind of events?
Yes. Usually they have them twice a year. They have one in April and one in October. And this is actually the 20th DEA Take Back Day.
Really? So it's been going on for 10 years here.
Yes.
That's amazing, because I feel like we've been talking about the problem of prescription drugs more so in the last 5 years. So I had no idea that this has been going on longer.
Yes, it's something that maybe, I think at the beginning they only did once a year, then they went up to twice a year. For a while they thought they would stop it, and then they started and continued it, which I think police departments really appreciate the opportunity to be out, making sure, doing something proactive to get prescriptions, medications out of our community.
That's great. So we also have coming up, which is a full year-round subject, is Alcohol Awareness Week, or is
Alcohol Awareness Month. So April is Alcohol Awareness Month.
I stand corrected. Yes. Yeah, because we really do need more than a week to be aware of alcohol. So we'll shift from drugs to alcohol. And what I think people forget, we see a lot in the news about opioids, and of course I would never minimize the impact that that's had on our community. But alcohol still really is the #1 addictive substance in the country, and causing the most illness and premature death. So can you just explain some of that? Because I don't think that everyone realizes that that is still living alongside of us.
Yes, and I think one of the things is that it's a legal substance. So like we can leave here, we can go to the liquor store and buy whereas other things, they have more restrictions, like prescriptions, and then other substances are illicit, so it would be hard to get to. But alcohol is available pretty much everywhere, and especially for youth, usually is as close as their refrigerator or the family's alcohol cabinet. So it's very easily accessible for anyone. And it's another thing that should be, secured so that, underage kids don't have access to them. But it is one of the socially acceptable substances. And because of that, it's so widely used. So even when we ask high schoolers, a very high percentage of them have already started drinking since they were about 13. That's usually the age where a lot of adolescents say they have had their first drink.
And that's not just like for religious purposes or anything. You're talking about recreational drinking.
Yeah, and the question specifically says like more than just a sip, like at a wedding or something like that. So yeah, they're drinking more than like, at church, if they're drinking holy wine, or if they're having some other religious, ceremony, or a wedding, or something like that.
Right. So, what are the resources in our community to deal with alcohol addiction?
So people can call 211. That is the state's resource place where they can, guide you to a local treatment place, a support group, support for the family. Whoever's calling can get information on resources in the community. But people can also walk into the Nashua doorway, which is at 268 Main Street, and be connected to services that way as well. So there's also Al-Anon, which can be accessed through, you can just go online and find the closest Al-Anon meeting, find their support numbers. There's also Alateen that is available for any child whose parents have, alcohol use disorder and might need support for themselves.
So Al-Anon is for Alcoholics Anonymous. That is for the actual person, but what about for family?
So Alateen is for the kids.
That's for the kids, but is there something of relatives of? I feel like there is, but I'm not sure what it's called.
So I can't remember.
Yeah.
Is that Al-Anon?
It might be Al-Anon, and that's different than
than alcohol, than AA. That's different. So that is for support.
Okay, right.
So they can, like I said, they can go to call 211 and get information there about whatever kind of support that they need. But if they need treatment, they can also walk into the Nashua doorway, which is at 268 Main Street, and can also be accessed by calling 211.
Okay. And it's really important for people to realize the impact, you know, any drug use or substance misuse, we're talking about alcohol, but the impact that has on the whole family, whether or not that parent or individual is making it to work or able to hold a job, or if they're functioning well at their job, or they're putting themselves in danger behind a steering wheel. So we really have to, we know that this has a huge impact on family members, and that's why those organizations, like you said, Al-Anon, Alateen, are created for family members also, because living with someone with an alcohol use disorder, yes, we have to say it that way, it can be very difficult.
Yes, it can. And it, like you said, it affects the whole family, but it also affects the entire community because of the things that you were saying. Are people able to get to work? Are they being productive at work? And are they getting behind the wheel, you know, under the influence? Those are all things that not just affect that person, not just affect the family, but also affect the community at large. This is a great opportunity, April, to really learn about alcohol. It's a great opportunity to learn about, you know, not using stigmatizing language around substance use, so that people are more able to access services and reach out for help.
Explain that a little bit about this stigmatizing language around
alcohol use.
Yeah,
yes.
around any substance misuse.
So
really.
we want to make sure that we use person first language. That means using literally the word person before anything. So a person with an alcohol use disorder, we don't want to call people like alcoholics, things like that, because that person is more than just their diagnosis of having an alcohol use disorder, right? They might be a parent, they might be, you know, a brother, a neighbor, a friend. There's so much more that describes a person that their disorder. So we want to make sure to use person first language in everything that we do.
Is there anything else, any other way that we can speak about it that is more correct, at least?
So.
Or non-stigmatizing, like you said.
Yeah, so, like I said, alcohol use disorder is the diagnosis, so we no longer use the word alcoholic, for example, even though it's in the name of some agencies or programs, it's no longer considered politically correct. So the diagnosis is alcohol use disorder.
And you see that too with smoking cessation. We call it tobacco use disorder now. And with the opioid epidemic, we've been calling it, you know, substance misuse disorder.
Substance use disorder.
Substance
or misusing
okay,
of a substance. Yes, yes.
So I feel like that changed on me. So at any rate.
Yep. And also it's really important to note that many people, we've seen an increase in liver disease due to alcohol consumption over the past year. Many people think because of the changes of the pandemic, exacerbated by isolation and the fact that other things that took up people's time, like getting to work or having to be present or around other people, is not there as a buffer to diminish people's alcohol consumption. So now they're at home stressed because, for example, women have been like carrying the brunt of a lot of the domestic, you know, stressors of the pandemic, whether it's making sure that their kids are remote learning, taking care of the household, and, you know, working on top of all that. So it can be very stressful. And for a lot of people, a lot of supports that they had in the past are not available right now. So they're going for, you know, a drink instead of talking to someone or finding other ways to cope. And we see that increase in social media of people talking about mommy juice and other, like, you know, Wednesday wine day and things like that. So it's really important to...
So like we normalize it, and we really shouldn't.
Exactly. So it's really important for people to, if they choose to drink in a safe way, and that would be drinking 1 drink per hour and no more than 2 drinks per occasion. But what we're seeing is that a lot of people are binge drinking, which is 4 to 5 drinks in a short period of time or per occasion, which can cause a lot of problems, especially with our livers, which is what kind of is able to process alcohol out of our systems.
And I did read that recently, that generally liver disease was found a lot more among men, but during the pandemic, it's actually gone up in women about 30%.
Yeah, so
which is really an incredible jump. I mean,
and
in
not
1 year.
only in women, but especially in young women. So even though it's usually seen later in life, middle age to older age, they're seeing it right now in 20-year-olds and 30-year-olds. So it's really important that people find more positive ways to cope, or find more support, or just in general other things to do besides alcohol, so that they can live long, healthy lives.
Yes, absolutely. Well, Lisa, thank you so much for agreeing to come on and talk to us about these important things, Drug Take Back Day and safe methods to dispose of unwanted prescription drugs. And also, we hope people do take time during the month to learn more about really the dangers of overconsumption of alcohol, and how to maybe obtain services and practice, if at all, safe drinking practices, and so that we can all get back to business and live productive lives.
Exactly. Thank you for having me.
We'll be right back.
Hi everybody, my name is DT Bruno. I work at Greater Nashua Mental Health. I am deaf and I use ASL, the same as some of you. The reason I'm here signing this message today is to talk about the importance of the COVID-19 vaccination to help reduce the illness due to COVID-19 pandemic. I have been vaccinated myself, and the reason that I did that is to protect myself, my family, friends, clients, and the community at large. Some of you may be concerned, feeling like the vaccine was made in just a year's time. I can understand your concern, but I'm here to tell you the vaccine has gone through countless clinical trials done on many different populations. They have done research on a lot of other viruses that are very similar to COVID-19, and all of that research can apply to COVID-19 vaccination and the production of it. I've gotten both of my vaccine shots and I feel good. I also feel a sense of relief, knowing that if I were to contract COVID-19, that my risk for death or hospitalization is much less. Many of my counterparts at Greater Nashua Mental Health have also been vaccinated to help reduce the impact of the pandemic. Some of you may have been waiting, anticipating your appointment for your vaccine. Some of you are able to get it now, and I strongly encourage you to go and get your vaccine. The more of us that become vaccinated, the sooner we'll be able to get together and socialize again.
Welcome back to Public Health Matters, where we talk about matters in public health. I'm Jane Goodman, Public Health Strategist with the Nashua Division of Public Health and Community Services. I'm now joined by Michael Apollo. Welcome.
Hello, thank you so much for having me.
Well, we're really happy to have you here, and you are the Public Health Emergency Preparedness Coordinator.
Correct.
At the division. Been very busy lately.
Just a bit, just a bit.
And so we appreciate you taking the time, because we know that we have a big clinic coming up this weekend. And believe it or not, emergency management manages a lot of these clinics for us. So let's take a step back. You came to Nashua with a CDC grant, as I did, although I live here. You did not. Where are you from?
Sure. So I was born in the Bronx, New York, and I grew up in New Rochelle, New York, which was actually the epicenter of the coronavirus pandemic in the United States around this time last year. worked in a few other roles supporting the pandemic in New York City, Washington, D.C. Then I came up to Nashua last July for a CDC Foundation position supporting the Office of Emergency Management. I worked for a few months there developing some plans, assisting at the public health testing events twice a week.
That's where we met.
And that's where we met.
So that's great. And so when you thought of emergency management and then you ended up in public health, I mean, it's probably not the trajectory, having studied emergency management in college and looking for things. So tell me what the differences are or how this fits into what you studied.
Sure, I do see a lot of similarities between my current role and traditional emergency management. And you've seen with our testing events, it relies a lot on working with partners, coordinating with other agencies, getting resources that we need to the scene or to support an initiative. So I would say interagency collaboration is something that's similar. And also just working with people from across industries, working with our staff internally, working with our volunteers at clinics. Those are all elements that I was familiar with via emergency management.
And it's a lot of coordination, of course. So when
A lot
we
of
talk,
moving parts. Each of these clinics, there's
literally at our clinics.
Dozens of different stakeholders and different pieces of equipment and supplies that need to be arranged and in order for things to go off without a hitch.
And so the equivalent to that, so when we talk about traditional emergency management, at least in the public's eye, we might think of a natural disaster, or we might think of a hurricane, a fire, or some other kind of thing where we really have to mobilize people to respond to this, make sure they're safe, they're evacuated. So during a public health crisis, it's a little different. And I just kind of want to walk through the clinic because, like you mentioned, there's a lot of community partners. And so we in public health could not respond to emergencies without our partners. They're just really critical to all the work we do. So you mentioned Nashua Fire. I know we have Nashua Police. We have United Way volunteers that help us out.
Yes, and for a long time we were utilizing the armory down on Daniel Webster Highway. So there was a lot of coordination that occurred there with the National Guard headquarters up in Concord, the actual facilities team that was in Nashua. At times we've had to call in the National Guard mobile teams to support us. That the National Guard mobile team members serve as specimen collectors to sort of amplify our efforts.
And we saw a lot of them in December, January. We met a lot of National Guard people.
Correct. And we did some pop-up testing events for some outbreaks. They were involved in those as well. So we really appreciate the work of our partners. We appreciate the support of our community during this pandemic.
And we've been fortunate in a lot of ways because of the nature of COVID. We've done a lot of our COVID testing clinics outdoors, which presents its own challenges. In the summer, it was too hot some days. In the winter, it was too cold to be outside. It was a nice relief to go to the armory and be able to still serve the city of Nashua and really the greater Nashua public health region. But we had to have that flexibility, and without people willing to open up their space to us, we wouldn't be able to do that.
Yeah, we have really perfected the drive-through testing model that we've been using since, I'm not sure when the division started testing, but it's always been a constant improvement.
I think last April. I think it's been over a year now.
Yeah, so I've heard it from the National Guard mobile team members. They say, wow, this is a really great system. You guys got it down pat. It flows well. You're able to process a lot of cars. And that, of course, occurs outside because it's dealing with cars. That means it's safest for our staff. It's safest for the clients coming to get tested. It's efficient, effective, and just an overall good way to manage COVID testing is in a drive-through model.
And so right now, we've waxed and waned with our testing.
Well said.
In December and January, we were backing up cars down Main Street. We had to leave the Elm Street parking garage, went down to the armory. We backed up traffic a little bit there before the holiday shopping, but that's okay. We managed through it. And now we're in a point where it's very steady, but not a lot of people. So I think that speaks to the decline a little bit in COVID exposure and hopefully an increase in vaccination.
Yeah, we are seeing a manageable number of cars now coming through our testing clinics, around 50. However, we are still seeing positive cases as a result of these testing clinics. So it just reminds us in public health of our mission to go out and test people for this virus, stop the spread, and prevent people from getting ill and perhaps dying if they have a severe case of the illness.
Right. So we just, again, yes, thank you for the reminder. It's wash your hands, stay 6 feet apart, wear your masks, and please, please, please get a vaccination if possible. So that brings us to our next topic of business. So you're very involved with vaccination as well.
A little too involved.
A little too involved. I think we all are at this point. I'm right there with you. So we've done a couple of really big clinics, and we're about to do a second dose for teachers. Specifically Nashua and Merrimack, I think, were the ones that really signed up the most for this clinic. And then we opened it up to the greater Nashua area and did, about 4 weeks ago, did 2,600 doses over the course of a weekend. So we're coming up on the second dose clinic. We've partnered with Fidelity Investments. You want to just tell me a little bit about that, even though I'm there all the time with you?
Sure. So I was actually up this morning at Fidelity getting things prepared. They erected a large climate-controlled event tent for us to use, and we're utilizing one of their parking structures. So we have folks come in to the parking garage, park their cars, exit out of their vehicles, enter our tent where they will see you to register.
Yes, they will.
They will then proceed down a long hallway, not a long hallway, a hallway that leads to where the actual vaccinations take place, and that's just a way for us to space people out and that sort of thing. They'll get the vaccine, and then they'll proceed to our observation area where the folks will sit around with us for 15 minutes if they're standard person coming in the door. But if somebody has a history of severe anaphylaxis, we'll have them wait with us for 30 minutes. And that's consistent. That's being done nationwide with these vaccine clinics. Once the person is done with their observation time, they're able to go back to their vehicles and leave. And we're seeing tremendous, this model that we're currently using at Fidelity is very effective. Folks, I've heard feedback, it took folks like 20 to 30 minutes to move through the clinic, and that includes that 15-minute observation time.
We hope you're not jinxing it for tomorrow.
I assure you that it will go off without a hitch tomorrow.
Yeah.
We have the right people in place. Our systems are our systems, and
We
they
are
work
getting
and
better
are
at it.
robust. Yes.
And I do want to give a shout out. These vaccine clinics are pretty amazing, whether they're for 30 people or for 300 people.
Or 3,000 people.
Or 3,000. They're pretty amazing in the sense that we couldn't do this at Public Health without volunteers. And I really can't emphasize that enough, because we have a lot of volunteer vaccinators, for example, a lot of retired physicians, retired nurses. We have school nurses that are coming over and voluntarily vaccinating on the weekends. And it's just this amazing thing. You know, I tend to work with the volunteers as well for registration, but I also check them in who are the clinical ones. And we had 70 volunteers that one Wednesday. So that's an incredible amount of people that are pitching in, beyond the public health staff. So I do want to give a shout out to them, and also to Fidelity for giving us this space, and for providing us also with another, 30 or 40 volunteers from the Fidelity Cares program that they run. So people are very willing, and there's a culture there of volunteerism. And so it's been really helpful. So,
yeah, our volunteer cohort is really remarkable. Back in January, we started onboarding both clinical and non-clinical volunteers. And we have a pool of about 50 regular folks that assist not only at these large clinics, as you know, but at our smaller clinics. I was at a clinic earlier this week where it was just me and one of the other public health nurses, and the rest were our volunteers. So from the person checking in the vaccine recipients, to the person vaccinating, to the person assisting the vaccinator, to the observation staffer, those were all volunteers.
and if somebody wants to get involved, for example, this is a good plug, because we
Sure.
always need more.
Absolutely.
How do you sign up?
Sure. So we're accepting applications for both clinical and non-clinical volunteers, and interested individuals can go on to www.nhresponds.org. That is the state's volunteer management system. They can create a profile on that website and select the Greater Nashua COVID team, and then someone will be reaching out to you to organize training and some other onboarding things that we
They
have
have
to
to
take care
complete
of.
like a criminal background check and
Yes.
those kind of things. We have to vet all the volunteers, especially when you're dealing with confidential information and stuff like that, when you're checking in patients and that kind of thing. So a lot of progress we've made. And so not only do we do these large clinics, but we're also trying to serve, close to our mission, which is some of these places that have less access. So we do a couple of different kinds of clinics, one of which being an equity clinic, where we've really gone out. I won't announce the location because we try to keep that a little bit hush-hush. But we do really try to reach out to the BIPOC community and to those that are in the low-income census tracts of the Nashua area that have less access to health care. And so that's another, if you will, mobile clinic, because we kind of set it up and then we take it down each week so that you can go to other places. So some other examples, I know we've gone to low-income housing.
Sure, we've had 2 clinics so far up in Merrimack at the John O'Leary Adult Community Center. Vaccinated there probably over 150 individuals to this date. And that's really critical that we go to a place that's familiar to folks. The current system works for the large majority of the population in the state, but if there's folks that have trouble getting down to Pheasant Lane Mall or accessing vaccine through one of these fixed sites, going to a place that's familiar to them in their community really helps people get vaccinated. So we're proud to be partnering with the town of Merrimack on that effort. From the police department, the welfare officer, Pat Murphy, has been a great help to us and finding these folks out, giving them the information on the vaccines, and the police department as well.
Yeah. And as we continue to take care of the city of Nashua, and we are responsible also again for that greater Nashua public health region, which are all those towns, the outlying towns, we're hoping to do some of those more regionally based clinics so that it's easier to meet people where they are. Whoever thought it was going to be a great idea for the elderly to sign up online was probably not really thinking that through. So we are able to go to some senior living, some assisted living, anywhere that really calls and says, can you set up a clinic for us? If they meet within those guidelines.
Yeah, we've done about, I would say, close to 70 mobile clinics out at different properties and with different organizations to sort of meet that mission of reaching those hard-to-reach groups and those groups that are disproportionately impacted from COVID-19.
Yeah. So do you get to do anything else besides clinics and clinics? What other things do you do for emergency preparedness? You clearly have more responsibilities that you have to get to during the week. I know that one thing we talked about yesterday was like Go Prep.
Yes.
So tell me a little bit about that.
So I had a great conversation a few weeks ago with the Boy Scouts Troop 19 of Nashua. We had a discussion about emergency preparedness and what the division has been doing to support the COVID response. So that's an element of some of my work, public engagement. I also spoke to a class at Riviera University, spoke again about our COVID response, answered some questions about accessing vaccine, answered some questions about 211 and Vinny and state sites and that sort of thing, and even referred some people to the Merrimack Fidelity Clinic that we were hosting later that week.
So you kill 2 birds with 1 stone.
Exactly.
Some of those things. And what can we talk about as far as, what can we think about as a family or somebody as far as emergency preparedness goes? Are there any tips you have as we hopefully exit COVID? There will always be something else, we know that. But as we exit kind of this phase, what is good to do as a family unit for emergency preparedness?
Sure, I would say financial resiliency is a very important topic. At the start of the pandemic, about a year ago, folks were laid off and that sort of thing and didn't really have any savings secured. So I would say if you're working now, start saving some money. You never know when you might need it. Sort of a rainy day fund to be able to support yourself in the event that you lost a job or someone was ill or injured. That's an important and critical step that families can take.
Anything else that they can keep in their homes or their, fire readiness or, anything else that they should be prepared for?
Sure. One of the leading causes of death in the United States is the traditional house fire. So I'd like to take this moment to remind everyone to install smoke detectors in your home if you have not already. And if you do have smoke detectors, make sure you frequently change those batteries. About every time the clocks turn, so twice a year.
Daylight savings.
Correct. Daylight savings. Check those batteries. Make sure you're smoke detectors and smoke alarms are fully functioning.
And carbon monoxide
Carbon
also.
monoxide as well, yes.
Yeah, so there's a lot that you can do to prepare and just be safe in your own home. Since we're spending so much time in our homes still and have for the last year, we just want to make sure people are safe at home and taking those precautions as well.
And it's also important to remind younger family members, so children and toddlers and things, that if there is some sort of an emergency in the house, that they have to get out. A lot of folks may think to hide in a closet or under a bed or in that sort of thing. You really need to evacuate as fast as possible. There's a lot of materials and stuff in homes these days that are very dangerous once there is an ignition source. So if there is some sort of event, exit your home immediately, gather, get a head count, make sure you know if anyone is still inside, and notify the first responders when they arrive on scene.
And we used to tell our kids just to meet by the mailbox. We had a meeting place. I don't know if they remember that to this day, but for little kids, I think that's really important. We had the little rope ladders. Again, we never used them, thank goodness. But we did have a designated meeting spot, and I think that's really important, especially for younger kids, so that everyone is safe and nobody's going back into a burning house looking for somebody.
Absolutely, and there's concerns about pets and that sort of thing. Frequently, pets do make it out of a burning building. I would say to never risk your life for the life of a pet. If you're outside of a burning house and there's a pet inside, once again, just notify the fire department once they arrive on scene, and they'll make an attempt
To
rescue the
Fido,
animals.
yes. All right, well, thank
Fido.
you. Thank you so much for these tips and for letting us know a little bit behind the scenes about vaccination and COVID testing. And so on that note, I do want to remind our audience that we do have free COVID testing every Tuesday from 3 to 4:30 in the Elm Street parking garage. You can make an appointment online, or you can call us at 589-3456, and we'll make that appointment for you. Want everyone to stay safe out there. Wear your masks, wash your hands, stay 6 feet apart, avoid large gatherings. And Michael, thank you so much for joining me.
Glad to be with you.